organized one conference in the year 2025 November, and again this second national conference is going to happen in the month of November ending 28th and 29th of November. So I invite you all from the core of my heart and all from the team to attend this in Hyderabad. So before starting, I just wanted to convey this message to you. Now I am going to share my slides. Okay. So is it visible now?
Yes, sir.
Yes, sir.
Okay. Thank you. So gastrointestinal influence on neurodevelopmental disorders. Actually, mainly this presentation is on evidence-based because there is no direct effect of this, but the evidence regarding these effects from variety of papers and presentations, we have come to know that this gastrointestinal flues, gastrointestinal different kind of neurotransmitter, they have a prolonged effect on this neurodevelopmental disorder. Okay. So now let us start. We know that gut microbiome doesn't just influence digestion, it also interacts with the brain through the gut-brain axis, which is a very well-known term to all of us. We have known that gut-brain axis is something which from head to tummy acts through some unknown pathway. And in 2024 study published in Frontiers in Nutrition, which is a very um, prestigious journal and work on this field found that maternal probiotic use reduced inflammatory markers. So probiotic use, they have dual effect. One is reduction of inflammatory markers and also improved early memory related brain response in infants. Another 223, that is 2023 trial showed that giving...
One moment, sir. Can you please make it screen share, side share, full screen?
Okay, no problem.
Okay, thank you. Sorry to disturb you.
Just a minute.
Sir, you can just press on the button which is there, plus minus के पहले जो button दिख रहा है, you can click on that. Down, नीचे. You can see minus plus on your screen. To the extreme right. Yes, more down. हाँ, उसके बाजू में सर. Don't touch that. उसके नहीं वो नहीं. उसके लेफ्ट में है, देखिए लेफ्ट में है. हाँ, just click on that. Yes. Thank you, sir.
Is it okay now? Yeah. So another 2023 trial showed that giving probiotics to very preterm infants significantly reduced neurodevelopmental delays at 2 years of age. While this trial focused on babies, other animal studies showed that even probiotics given to mothers can increase nutrient transport to the fetal brain. Okay. So micronutrients that matter, that is iron, folate, iodine, vitamin B12 and vitamin D. These are the main components of micronutrients. A 2024 systematic review in nutrients compiled neuroimaging studies showing how maternal deficiency in these nutrients altered fetal brain structure. So you see, I am just discerning one by one all the things that are coming through evidence-based. It is no longer about just preventing deficiency, it's about optimizing brain outcomes. Iron ensures oxygen supply to the growing brain. Deficiency can lead to reduced myelination and delayed cognitive development. We know that because iron and to some extent iodine also linked to that. Folate and vitamin B12 support DNA methylation. Iodine is essential in maternal thyroid hormone and in turn regulates fetal neurogenesis. So iodine is very much essential. Vitamin D has receptor in fetal brain tissue and so and so. So you see this picture which shows a two-way communication, that is brain to gut and gut to brain. So in brain to gut, there is stress, anxiety, and other mental health conditions which have physiological consequences such as disrupting gut motility and functionality. We know that a lot of if our mental state is not up to the mark, there is also deep impact on our belly and gut. Our bowel movements are just impaired, which results in symptoms such as constipation and stomach pain. On the contrary, enteric nervous system in the gut produces neurotransmitters such as serotonin, which is the commonest and most popular one, and metabolites which impact mental health condition such as stress, anxiety, and depression, and may even contribute to personal characteristics. So the gut-brain axis is a critical driver of early brain growth, with the first 1,000 days of life representing a critical window where microbial colonization and neural development occur in parallel. Okay, so this is the window period where the colonization, which is very much important because the stagnation of these bacteria and neural development which occur in parallel motion. So disruption of this balance during development is strongly linked to NDD like ASD and ADHD. The gut influences the developing brain through three primary routes. Just remember three main primary routes. I will also show you in that some schematic diagram later on. So immune education, gut microbes train the immune system. In NDDs, a leaky gut can allow toxins like lipopolysaccharides to enter the bloodstream, triggering maternal immune activation, MIA, or neuroinflammation that disrupts synaptic pruning. We know that in neuroplasticity, how important is synaptic pruning. So if it is impaired or disrupted, a lot of things happen, and the brain's way of cleaning up unnecessary connection that occurs through pruning is just impaired. So you just imagine how much it is affected. Neurotransmitter synthesis. Gut bacteria produce or modulate key chemicals including serotonin, that is 95% of which is made in the gut, GABA, and dopamine. Imbalances in these can lead to the social and motor deficits seen in autism and hyperactivity. And the third number, so what is the three? Number one is immune education, number two is neurotransmitter synthesis, and number three is metabolic signaling. Bacteria ferment fiber into short-chain fatty acids like butyrate, which are essential for maintaining the blood-brain barrier and supporting myelination, that is the insulating layer around nerves. Influences on specific disorders. So let us come to this very popular and common NDDs. Number one is autism, frequently associated with lower levels of bifidobacterium and higher levels of clostridium. So remember these two, which will come again and again in the names. Specific metabolites like 4-ethyl phenyl sulfate have been found to induce anxiety-like behavior in animal model. I will show you a picture in the last. ADHD, research suggests a link between gut dysbiosis and the dopaminergic reward system. Children with ADHD often show reduced microbial diversity and lower concentration of certain short-chain fatty acid. Now, Rett syndrome, characterized by significant shift in gut bacteria, and very importantly, whenever this shifting occurs, the regression process starts, which may exacerbate the severe motor and mental decline associated with the disorder, because we know that in Rett syndrome, the regression is very prominent. And this is very much in the same coinciding time with this shift in gut bacteria. Now, this is another schematic diagram. From you see the gut in the left side, there are the extrinsic factor, intrinsic factor. So dietary habit, lifestyle, infection, these all modulate the gut microbacteria, and intrinsic factor like genetic, metabolic, immunity, and hormone. They both affect this gut microbiota, and which in the back, that is in the back and forth things, that is through neurotransmitter, metabolites, cytokines, and PAMs. Neuronal glial epithelial axis is disturbed, hypothalamo-pituitary axis is disturbed, and visceral nerve are also inhibited. In the result, these things happen like cerebral vasculature is disturbed, like atherosclerosis, multiple sclerosis, and arteriovenous malformation, neuropsychiatrics like pain and migraine, anxiety, depression, and autism spectrum disorder, and neurodegenerative in the late ages like Alzheimer, Parkinson, and amyotrophic lateral sclerosis. So studies have shown that children with ASD exhibit reduced diversity of gut bacteria and overrepresentation of certain pathogenic species. What are these? Most important are the Clostridium and B-sulfovibrio, and lower levels of beneficial bacteria like, that is the things which benefit us, these are lowered, and the same like HDL and LDL cholesterol, you just remember. So lower levels of beneficial bacteria like bifidobacterium and lactobacillus. So dysbiosis in ASD is thought to affect brain function through various mechanisms, including the production of neuroactive metabolites such as SCFA. For instance, these fatty acids like butyrate play a role in maintaining the integrity of the blood-brain barrier and regulating neuroinflammation, while their imbalance may contribute to the atypical neural development observed in ASD. So this is very much clear that typically these two bacteria, Clostridium and D-sulfovibrio, which are found also in overrepresentation or large amount where the ASD brain has been found. You see, it is a table-like feature. Just a minute. Yeah. You see relationship between various NDD and gut microbiota, including potential microbial imbalances, key findings and implications. So you see first, commonest ASD. Altered gut microbiota like what I told just now, bifidobacterium, Clostridium level higher, linked to gastrointestinal symptom and neuroinflammation. So what are the changes? Reduced diversity of gut microbiota, altered levels of bacteroids, Clostridium and bifidobacterium. What are the key findings? Children with ASD show higher levels of Clostridium boltei, decreased bifidobacterium abundance. Implication, microbial dysbiosis may contribute to ASD-related gastrointestinal symptoms and neuroinflammation. Next is ADHD. The main bacteria, I am not speaking about the total details because it is a time consuming. So you see the first two one, that is Firmicutes and bacteroids. These are increased and these may influence brain function and behavior. So reduced microbial diversity, higher levels of these two bacteria. Studies suggest a higher prevalence of gut inflammation and dysbiosis in ADHD children. Intellectual disability, there is reduced lactobacillus and bifidobacterium abundance, leading to gastrointestinal disturbance, which may exacerbate cognitive symptoms. So bloating, flatulence, constipation, which are very common in case of ID also. Imbalanced gut microbiota with reduced lactobacillus and bifidobacterium levels. Research shows that children with ID often have gastrointestinal issue linked to microbial imbalances. Next is schizophrenia, which is not very common in our neurodevelopmental conditions. Developmental coordination disorder, yes, this is much common. DCD children have shown altered gut microbiomes, which may correlate with motor coordination impairment. Tic disorder, increased streptococcus level and other microbial changes are associated with tics and neuroinflammation. But these are all just in support of this. But it is not the causative organism or causative like things. So you cannot come from the etiology from this subject. Cerebral palsy, altered gut microbiota with reduced bifidobacterium and lactobacillus linked to gastrointestinal issues commonly seen in CP. Children with CP often present with gut issues and reduced microbial diversity affecting overall health. Now coming a very common issue in case of our children, this feeding problem. So what are the main things which affect food selectivity? It occurs due to variety of reasons. There may be something in the mouth, articulation problem, this structural difficulty in the mouth, and also due to some sensory issues in case of autism or coordination disorder, food neophobia, food refusal, ritualized eating, rapid eating, disruptive mealtime behavior. We have also multiple works on this in the last 2 to 3 years. That is, the eating and feeding behavior of children are severely impaired in case of this neurodevelopmental counterparts. So what are the short-term consequences? Weight loss, dehydration, low energy, failure to thrive, and long-term is malnutrition and vitamin deficiency, iron, zinc, calcium deficiency. That is the micronutrient deficiency. In addition to concomitant feeding problem, higher rates of co-occurring GIC symptoms. So what are these? Most common constipation, alternatively diarrhea and abdominal pain among children with autism have sparked significant concern. Sensory sensitivity in ASD may be one factor contributing to the mealtime behavior, indicating that taste, smell, and texture play important sensory roles in accepting or rejecting food. I am not going into the details because this is a totally separate another class on these things, like why these oral sensory issues occurs and how to combat with these things. This is very common. Now, maternal health and prenatal factors. Factors such as maternal diet, stress, infections, and antibiotic use during pregnancy shape the gut microbiota of the developing fetus. So, in case of from the very womb, and it was our topic from tomb to womb, so womb to world, whenever the child is even in the mother's womb, the commensal bacteria, commensal things, and the beneficial things of our body, they also are a lot of been affected. So mode of delivery, how it changes, how it modulates. Normal delivery or cesarean section plays a crucial role in establishing the initial gut microbiota. Infants born through vaginal delivery are colonized by beneficial bacteria from the maternal, vaginal, and intestinal microbiota, such as lactobacillus and bifidobacterium. In contrast, cesarean delivered infants are exposed to skin-associated bacteria like Staphylococcus species, resulting in delayed microbial diversity. So in this case also, normal delivery is more beneficial. And this altered microbial colonization has been linked to a higher risk of developing NDDs such as ADHD and ASD, but you cannot directly make it a cause that cesarean section causes ASD. Neurodevelopmental disorder and from gut microbiota. So this is a, you remember that our pathology classes in the second professional MBBS, you see this is the cell turnover and the cell line. So how does it cross? These are the 4 neurodevelopmental disorders, and the pathway, one is immune pathway, one is the neuronal pathway, and one is the endocrine systemic pathway, through which this microbiota pass through and make a lot of changes, which just is in the lower in the brush border cells. Now this is a animal model, that is the rat model. You see there are a lot of interleukins are also involved, like IL-6, IL-17. These are all having a direct effect on the brain. And you see that is the occipitoparietal region. They are making a lot of changes where the Treg cells, TH, that is a T helper 17 cells, these are activated and causes some changes in the amygdala and prefrontal cortex of the brain of neurodevelopmentally affected children. So this increases the contraction of colonic smooth muscle, dilates colonic arteries, and increases serotonin release from gut chromaffin cells and decrease gastric motility, which could be easily related to the gastrointestinal abnormality frequently observed in many autistic patients. You see, this is a very vast and long evidence-based things from different work of world-renowned papers. So Fingold et al. In 86, in USA 2010, they showed on 33 autistic children that these are the main bacteria, that is the bacteroidetes, firmiculates, desalvovibrio, and clostridium, which are mainly responsible for autism causing. And next, there are a lot of cases. You see, these are the common 2 bacteria are very much common, that is bifidobacterium and desalvovibrio lactobacillus. You see, in case of ADHD, there are 14 male ADHD patients. You see, there is Prevotella, parabacteroids, and Neisseria. Okay, so these are the common things which some are increased, some are decreased. So this is the imbalance between these bacteria. These are the commensal bacteria which stays in our gut, but in optimum amount. Whenever there is imbalance of these things, this make a lot of change in the gut-brain axis and just a feedback mechanism to the brain which imbalances our this neurotransmitter, and this is the cause. In case of you see ADHD, there is also Faecalibacterium and Fusobacterium. One is decreased and another is increased. Now you see these, we see very commonly in evidence-based diet, that is gluten-free, casein-free. Actually, in our country, still autism not that common, but in all total, in our country, it is still now less than 60. 1 in 54 or something like this, but worldwide it is near about 1 in 40. So obviously it is very clear that in Western countries and in fair complexion people, it is much higher. And there is, you see, GFCF diet also is found everywhere, and they are very much scared of this gluten. So you cannot see this gluten directly causes this autism, but it has been seen beneficially that gluten-free, casein-free diet lowers the symptoms which are very common in case of autism. Ketogenic diet we have been using for a long time in case of epilepsy, in refractile and intractable seizure, you know. So these also proves that his diet makes a lot of modification in case of these neurogenic things. So probiotics and NDDs. Probiotics are live, non-pathogenic bacteria and yeast administered to enhance and promote. So previously we have been asking about these prebiotics. Now the probiotics, yeast is very common. They enhance and promote microbial balance, especially in the gastrointestinal system. They mostly consist of Saccharomyces boulardii yeast or the lactobacillus and bifidobacterium species. Their function is to lower the intestinal pH, that is, make it acidic, decrease colonization by pathogenic microbes, and regulate the host's immune response. So in any case, these yeasts are diminished. They make a lot of change. Fecal microbiota transplantation and NDDs. Gastrointestinal symptoms such as bloating and abdominal pain are frequently described in people diagnosed with ASD. ASD patients have a different intestinal microbiota composition to healthy controls. So the most of us we are very much concerned with autism because day by day these cases are much increasing. So interactions between gut microbiota and neurodevelopmental disorder, this is a compact and schematic thing. So composition of gut microbiota, dietary habits, probiotic, prebiotic quantification, fecal microbiota transplantation, participation in pathophysiology and symptomatology, which all affect this neurodevelopmental disorder causation and happening. So at last, in the age of reels, we cannot, I think more than half an hour concentration is very difficult. So I tried to minimize the total thing in few slides. So let us come to the take home message. So neurodevelopment starts in the gut. The first 1,000 days of life represent a critical window where the maternal microbiome, infant gut colonization, and brain development are tightly linked. It is obvious now. Maternal gut health and nutrition are modifiable determinants of fetal and infant brain outcome, not just immunity or growth. So some new concepts are coming every day. Gut dysbiosis and inflammation can disrupt brain development via immune activation, altered neurotransmitter, and impaired blood-brain barrier function, contributing to ASD, ADHD, blah, blah. Micronutrient optimization, that is iron, folate, vitamin B12, iodine, vitamin D, all matter for brain structure and function, not merely deficiency prevention. Children with NDDs frequently have GI symptoms and feeding difficulty, which can worsen nutritional deficits and neurodevelopmental trajectories. Yes, very much common, because this nutritional deficit also adds a lot in case of cerebral palsy, in case of Rett syndrome. This due to this drooling or some oral sensory issues, a lot of micronutrients are deficient, and it causes, in the vice versa role, some deficiency and making some uh, deterioration of the health conditions. Early intervention, definitely the maternal care, delivery practice, diets, probiotics, and targeted nutritional strategies offer a real opportunity to reduce risk and improve outcomes. So, take home message is protect the gut early and you protect the developing brain. Thank you for your patient hearing. So, I am giving the mic back to Dr. Ketki.
Thank you so much, sir, for such a interactive, insightful, and enriching session. And audience, any questions you can ask?
Hello, sir.
Yeah.
Sir, nowadays we see that many parents are being told, the parents with autistic children, they are told to start GFCF diet without any testing. So, what should be the right way of starting GFCS? It should be started on a trial basis, or some investigations should be done first to see whether a child is actually allergic to GFCF.
Yes, definitely. Actually, it is very difficult to ascertain that which children are actually GFCF resistant or something like this. Because, and there is no specific, in the textbook, it is not yet uttered that GFCF causes a lot of problems in autism. But actually, in our India, the pattern of diet is so much variable, because in North India there is gluten is used rather more. In the South India or in the eastern side, there is not so much of gluten dependent diet. So it cannot be generalized, but it has been seen in few cases that gluten free, casein free diet makes some benefits. So it is better to avoid, but you cannot make any rule that you cannot take. But one thing must be generalized for all, that sweet products and calorific products should be avoided, because these cause a lot of weight gain and also some hyperactivity. So I think this is better. You cannot, you can just avoid these questions of GFCF and go modulate the, their mind to other side key. They rather concentrate on these things key. You rather minimize your child's diet, because a lot of autism children are a lot of bit
Yes.
heavy and they are getting healthy.
So basically, you're saying, sir, that we have to make sure that parents are giving a healthy and balanced diet rather than thinking about
Yes.
avoiding a particular food.
Yeah,
Yes,
it's an
but in
extreme
Western
diet.
countries, specifically in US and Europe, I have personally seen that GFCF plays a big thing, because they in the all shopping malls there are separate racks for GFCF, because they are this all frozen things, and they mainly depends on these gluten diets. A lot of cases, these they are रोटी और जो चीज वो लोग लेते हैं, so these things are a lot of gluten mixed, so in their diets it is makes it problematic. But in India there are so much variety of foods. I don't think GFCF, because we take a mixture of all things throughout the year. So in our scenario, I don't think in Indian scenario it is very much restricted, or you should be very strict regarding these things.
Yes, sir.
My
Okay. Thank you, sir. Thank you.
So there's one question in our inbox by Smita Bajaj. Are there any ways to look for gut microbiota? Are there any references for age-wise flora?
Actually, ma'am, this is I am not very much sure about that because we can make some stool culture or something like this, but in a very few cases, and it you see all the cases, it has been mentioned that 23, 25 cases, you may get only one or two cases where you can get these things, but it takes a lot of time. So I don't think there is specific such any test where you can test these things, but definitely the stool culture can be done for this bacteria. And this infrastructure is also not present in a lot of places of India where this typical probiotics or prebiotic, this microbiota can be examined. And in a very few cases, this is supportive or beneficial, is found in our normal microscopic things. So, routinely, stool culture or something will not be in, I mean, research purpose, it can be done. And we have been also started a research with NIT, that is the National Institute of Technology, Durgapur, recently, because their two scientists have become very interested about these things. And a lot of work have been done in China, Hong Kong, Japan regarding these things. But I don't think in our regular practice it will be very much beneficial. Is my opinion.
So
So there is
what is your opinion on fecal microbiota transfer? There are plenty of studies going on fecal microbiota transfer to improve the gut health and improve the gut microbiota. So what is your take on this?
Fetal microbiota transfer.
your transplant.
Transplant.
Transplant, yes, it is just, it is not a very old one. It has been started very few days, I think. I
Yes.
don't know before this it has been done. So
Yes.
I think it must be beneficial effect because this transplant, if occurs in the specific, but time is very important because in the active period, if can only be done, then it will be beneficial. Otherwise, when the changes have been already made, you mean after 5 to 6 years of age, when there is some permanent changes in the brain, so how much it will affect, I am still very much doubtful.
Yeah,
So
that is quite doubtful, but plenty of studies are going on, and especially AIG, Asian Institute of Gastroenterology, which we have in Hyderabad. They are doing some research on this aspect. So they are still working on it. But as you said, it would be beneficial only in the early years of brain development and not
yes,
at a later age. And that too, the improvement they have predicted is about 20 to 30% of changes in the neuronal functioning, not more than that.
exactly.
So I have one question. How long we can give probiotic?
Okay. And also one thing I wanted to ask that, as Dr. Nita is saying, but these studies, they will always include all the other factors similar. Like we don't know if prebiotic only they are having 20 to 30% effective. Like they will be giving all the therapies along with the prebiotics. So we don't know if per se only the 20 to 30% improvement is because of the prebiotics. So
No,
that is
I'm not,
also.
Dr. Reena, I'm not talking about the prebiotics. I was
Mm.
talking about the fecal
Fecal micro.
microbiota transplant.
Okay. So, okay, but that thing also, I'm saying that that thing also would not be given as a single treatment. It will be
Hmm.
always multimodal, right?
Yes, yes.
And
And
that
that
too,
they do a kind of mapping of the microbiota. They analyze the gut microbes and then transplant with the healthy gut microbiota. That is what they are doing. But it's still in an initial phase.
Mm.
Have to
Yes,
see
it's
where
not
it goes.
much things have not been done still now on this phase.
Yes.
there is
So
one question that
practical question by parents or therapists, I would ask that how long we need to give prebiotic or probiotic combination, and uh, is there a natural resource they can replace? So most of the time, parents would want to know about this.
Yeah. Actually, a lot of good probiotics are not typically meant to give in these neurodevelopmental disorders, not for diarrheas. These are because the amount is different. to control a diarrhea, antibiotic associated diarrhea, which are commonly very common in our scenario in chemist shops we get. This is not the same amount which is given in case of autism. It is much higher one, and it should be given a minimum for 6 months. Otherwise, it will not be able to change the total concomitant bacterial level. So, but I think it is still up to under trial. So don't go for this. It is, it's my take-home message.
Okay. So there's one more question in inbox. What are the tests or investigation to understand gut health of neurodivergent kids, and at what age it can be done? I think it's a similar question.
Age is always 2.5 to 4 years. It is the best age to do this stage. But what test? It is the stool culture, some virology culture, bacterial culture. This can be done, but still it is not very much in a frame manner, not very phrenetic. So we cannot give you that proper schedule regarding which test can be done. But you, in some genetic things, whenever the whole exome sequencing is done, there are some things have already been found where the few genes are responsible for typical this gastrointestinal change in the gut. So in these cases, it helps, but typically only test some, yes, RNA sequencing is done in few cases, but these are all very circumstantial. It not be very confirmative test. Okay.
Sir, can we do TTG serology to ascertain if the child is having any gluten uh, allergy or something like
Yes, we
that?
can. Yes,
That
we
can be
can.
done in a very large scale because mostly if we see North Indian population, many of the kids and even adults would be having this TTG IgA positive but not diagnosed. So it is quite prevalent in North India. That is one basic test that is not very difficult also to do, though. So we can do before starting the child on any kind of restricted diet. So that can be done.
IgA is very supportive because in a lot of cases in this autism, we have already seen there's a lot of allergy also. So IgE also is raised.
Okay.
Okay. And in asthmatic, in a lot of cases, there is a high rate of IgE. So immunoglobulin IgA is not only increases in these things, but it only becomes supportive. So
I
if
am just
people
saying for TTG IgA, not per se only
TTG,
IgA,
yes, yes.
TTG IgA,
TTG can be
yes.
done, but not routinely. If you think
Not
that
routinely.
probiotics are very much responsible and there is a lot of gastrointestinal symptoms, then we can go for TTG. Definitely.
Okay, sir.
Thank you. Anyone else?
Dr. Vishal sir wanted to add something.
Yeah, sure.
Meanwhile, I just want to have one more question for you, sir. Many parents who are coming to OPD with kids like 3, 4 years, 5, 6 years age also, and they've already started gluten free and casein free, and listening it from some video or from a doctor or a therapist anywhere, but they have already started GFCF. And now they want a confirmation from us that what do we suggest to them? What do we advise that you continue GFCF or you introduce all foods? So, what should be the, what should we do in that case?
I think it mainly depends on your profile of the patient because if they can, GFCF diet is actually costly. So if they can afford, I think they should go for this. And they have, if they have seen some dramatic change after starting the this diet, then definitely they should go on. But otherwise, it is not beneficial. You cannot encourage. I am telling you.
Yes,
You can
yes,
support
yes,
it, but
yes.
don't encourage to do this.
Encourage for it. Okay.
Vishal, anything you want to
Recent
add?
AAP guidelines, they have clearly told that there is no role of GCMF diet. Still, as you said, studies are going on, but as we go with guidelines, I think they are not recommending unless it is proven allergy. like
Hmm.
you said.
True.
So if we stick to guidelines, we should not encourage
Yeah,
this
absolutely.
diet.
Definitely.
Yes. And about transplant, I think there are studies which are showing effect. So there is a change in the behavior. There are almost 3-4 studies which have shown that transplant do changes the behavior, but it needs, it's kind of, the sample size is too less, so needs more studies and on different populations, locations.
Right. Anything else?
So natural remedies to keep the gut healthy, to maintain the biases for the brain development.
Always
Tips
go
for the
for a lot
parents
of
and
fibers,
therapists.
and a little bit play time for the children. That is very much needed. आज के
Hmm.
सिनेरियो में सबसे ज्यादा वही चीज है कि बच्चे को खेलने के लिए कुछ टाइम नहीं मिल रहा है.
Hmm.
Many youngsters also compelled to do their heavy bag on their back, and whenever they come from school, only school time they get for playing, and whenever they come from school, again they are thrown into the tuitions. I am telling about this 10 years, 11 years, 6 years, 8 years, this, not 4 to 6 years, they are not going to tuitions. I don't know the scenario everywhere, but a little bit fibrous diet. Fibers should be there. Only chicken based, only this heavy protein based diet is not going to help. So who the people who are veg, uh, they are also taking not that much of fiber. That is that ghee, uh, I mean this paneer. These things are making a lot of changes. So I think and fast food, less activity. So I think epigenetic factors and environmental factors cause a lot of change. So I think this should be most ascertain कि बच्चा कुछ खेले, कुछ physical activity हो. Otherwise, it is very difficult. Only changing the diet, it is not going to help. If the gut motility has to be energized, then the child should run a little bit. Movement is there, should be there. This is my opinion.
Absolutely.
Okay.
So we conclude the session today, sir. Anyone, any question? All right. Thanks a lot, sir.
Thank you all for joining.
Good night, everyone. Bye.
Good night. We will meet again in the next month. So hoping everyone to join again in the next month webinar series.
Thank you so
Good
much.
night, sir. Thank you so
Good
much.
night. Bye-bye.
It was a very insightful session. Thank you so much.
Thank you for the wonderful session. We can end the meeting now.
Bye-bye. Good night.
Bye. Good night.